This medical update is brought to you by Dignity Health.
A total hip replacement is a procedure that we as orthopedists can provide for our patients that have advanced arthritis of their hips, similar to knee replacements for patients who also have advanced knee arthritis. The hip replacement procedure is a very good procedure and gives our patients excellent relief of pain and mobility. It's been done for many, many years. We've always tried to improve or enhance our techniques to enhance the outcome of our patients and minimize postoperative recovery issues. The anterior approach was one that we have developed over the years to try and minimize the postoperative recovery issues and also enhance how we do the surgery. It really has to do with the approach to the hip in a way of providing that patient with a hip replacement operation. So it's how we navigate to the hip. It's from the front of the body as opposed to from the back of the body. Our hope is that the anterior approach to the hip does several things that are beneficial to the patient. One is to try and enhance or make the recovery a little bit better for the patient. The patients that are candidates for any hip replacement procedure are those that have advanced hip pain from advanced arthritic changes of their hips. It's usually a patient that's gone through several years of progressive increasing difficulties with their hip, with restricted range of motion, decreasing gait, difficulty getting up and down from the sitting position. Provoking the hip doesn't tend to help things. It's working around the hip as best you can, because what we want to do is have you delay the operation until you really need it. For more information, please visit us at dignityhealth.org/Bakersfield/ortho.
To see more medical updates, go to kget.com and click on the Medical Update link.